Welcome to us. I am Rochelle from Babies in Bloom. So I am here today with Dr. Kim of RiverPath Chiropractic. And this is the next in our little series of kind of getting to know you. We want to know the providers, know everybody in our community, because for us here at Babies in Bloom, it really is all about referrals and knowing what your other community members are, what you can get, what services providers have, those sorts of things. So without further ado, I'll let you introduce yourself. Tell the people who you are, why you are.
Perfect. Like she said, I'm Dr. Kim. My husband and I have a practice in Del Mar, a chiropractic practice, but we primarily see pregnant moms, babies, kids, things like that. So we've really focused on that community. We have extra training in that community as well. And really, I mean, I'm happy to be here. It's beautiful here, and I know that so many families are helped here, and so many of our patients come here and just, they love it. So it's great. And
that's kind of one of the reasons why we wanted to get to talk to you is, like
absolutely.
She said, they specialize in pregnant women and babies, and we are very, very blessed in the San Diego area that we have so many great chiropractors and things, but certain offices you just see do a little bit extra, learn a little bit more about the demographic of people that we have. So tell me a little bit about why somebody who is pregnant would come and seek chiropractic care.
Absolutely. I think the biggest part about what you do is the why behind it, right? Mm-hmm. And so, quick story, we had our first in school. We've had two home births, but the first really kind of set us on our direction. So in school, there's a ton of things that you can get into and learn. We had our baby at home. She came out, she was really in a fight or flight response, fast heart rate, breathing fast, things like that. So here we did this beautiful home birth, no interventions. And somewhere between being perfect inside and being born, so really the birthing process, really got her in this fight or flight response. And so we're, taken back. What happened between now and then? And so here we were getting ready. Our midwife wanted us to have her checked at a hospital. We were really adamant. We want her checked by a chiropractor. We were still in school. So it's 5 a.m. We called everybody we knew. We had our chiropractor come to our house, give the correction, and man, it was, you just saw the tension leave. It was like, we have it on video, and everyone who sees it's amazed. The eyes opened, her breathing normalized. We ended up not having to go to the hospital. And it's such a profound thing that we said, okay, that's what we're doing.
It's our teaching moment right there.
Absolutely. We do home visits for that reason. And that midwife actually went on to integrate craniosacral into her practice, and she always, credits that experience with it. So that's a huge why for us. We love being around pregnant moms and babies, facilitating natural birth, and that's, I think, one thing that we have in common here. Mm-hmm. And so that's sort of our why. And I can kind of get into briefly what we do. A correction for a baby is very, very gentle. You're essentially using their breath. And one thing that our chiropractic training has brought us is a really sound, understanding of the nervous system and the implications of birth. And, there's a lot of pressure coming through the birth canal on the skull and the delicate, body of the infant. So, and so we have that, and our chiropractic training really taught us to be very specific with what we're doing. So there's specific areas of the body that we look for tension and to release it. And so, yeah, it's a great thing. We get to hold babies all day. And so,
well, I think as far as babies go, whenever I suggest chiropractic care or craniosacral therapy, people don't think about just I don't like the word trauma because I think it's a negative connotation,
sure,
but there is a lot of things that happen to their bodies as they corkscrew their way out. Sure. And I think we don't think about that.
Right. Well, they're very resilient, right? Mm-hmm. But for us, I mean, their spine is so delicate. Babies almost feel like little jelly beans, and so they are very resilient. Their heads will mold, and a lot of times they'll pop up. But we do see those babies who, are having trouble with the symmetry of their head. And what brought us up to coming here, what brought that up, is the lactation support. And so the cranium has a lot to do with the latch and the tongue moving out and the jaw and everything like that. And so that's kind of what brought us up. We see a lot of babies for that. The other big thing, like I mentioned, my daughter was in fight or flight, right? That sympathetic response. So one thing that a correction will do is bring that baby into the parasympathetic, that rest and digest. And what's more important for babies than resting and digesting?
That's all they have to do.
Right. And so what we tell our moms is you're going to see two things. The baby's going to poop maybe a lot, and they're going to sleep a lot. And so those are just, you know, we have babies who come in who haven't pooped in a while, and I'm usually pretty confident telling the mom, you're going to get a diaper before you leave. And it usually happens. Yeah. And so, you know, there's also things with symmetry, turning head side to side, or a torticollis, you know, a contraction on one side. So we see babies whose moms were under care through pregnancy. We check them. And that's the big thing that you'll hear us say is we just want them checked. Maybe they don't need anything and they're perfect, and that's great. The biggest thing is just checking them. And so our Wi-Fi password is get your baby checked, because that's our goal. And so they may need something, they may not, but regardless, they're going to get into that rest and digest. Like I said, it's very gentle. It's not what you'd think traditional chiropractic on a baby, anything like that. So
what's the difference for people who don't know between chiropractic adjustments and craniosacral therapy?
Sure. The theory behind it is very similar. So you're assessing essentially the nervous system. We're using the spine as really an anchor to access the nervous system. So the brain and spinal cord have wrappings around it, and those are anchored to the spine, especially on the occipital bone and the sacrum. And so the fluid that pumps and bathes those tissues in nutrients and removes waste can get a little bit stagnant if those tissues that anchor to the spine are, you know, if there's any torsion or fixation. And so with craniosacral, you're really creating almost a vacuum and removing any torsion. It's kind of like wringing out a towel. You're going to get stuck in the middle there, and you're not going to get that move. So that's really the idea behind craniosacral. The chiropractic comes in. It's the same idea. You're improving the connection between the brain and the body, really using the spine in the same way that, you know, you would take an aspirin through your mouth. You're not treating your mouth, but you're using the mouth to access your body. So we use the spine as a way to access the nervous system and really improve the proprioception and the connection between the joints are constantly talking to the brain and back and forth. And so that's really what we're improving.
And then I know we're going to talk more in just a second about what you're going to be doing here, but I'm pregnant. Why should I see a chiropractor?
Yeah.
You should see a chiropractor if you're pregnant. But why?
Of course. The easiest question, really the bread and butter of chiropractic, right, is pain relief. And so chiropractors have been known and become popular for back pain, neck pain, headaches, things like that. That's really, I tell people, a great side effect of care. So that's not our intention. There are a lot of chiropractors out there, and God bless them, who help a lot of people with pain, and it does work great for that. But if you're experiencing pain, there's a lot that's gone on in your nervous system before you're actually feeling that pain. So the pain receptors are such a small part of the nervous system. And so there's a lot of physiology that happens leading up to that pain. So if you're experiencing pain, which over half of pregnant moms do, you can get some really good relief. And that's the good news. The other thing is with optimal positioning. So you have ligaments that literally attach your uterus to your sacrum.
I always liken it to like the Macy's Thanksgiving Day parade with all the little balloon things.
That's great. They should have a big uterus, right?
Yes, they should. We could do that. We could have our own little parade.
I think we
But
should
yeah,
do
so
that.
be thinking about that visual as she's talking about your hip bones.
Yeah, or you can picture just a big balloon, you know, in the pelvis. I mean, I guess a lot of people don't picture the pelvis. Yeah, so
picture the pelvis.
Let's go with the balloon, the parade. But yeah, so those, if there's any torsion, the sacrum is really kind of a triangle shape. If there's any torsion, it moves this way and it moves this way. If it's stuck, you're literally going to have pulling on the uterus, and that's going to make less space. So we do not turn breech babies. However, we do make more space, and babies want to be head down. Sometimes there's, you know, a short cord or something anatomical that prevents them from being head down, and it's just a variation of normal, which I'm sure you guys know. But for the most part, they want to be head down. The head is the heaviest. It wants to migrate down. So we make that space, facilitate the space. There's also been reports of a shorter labor time and things like that.
Because it's all about alignment. It's all about
Absolutely.
fetal positioning. And if you're all tense and your hips are all wonky and your spine is wonky, you don't have a really good bowl to set the baby into.
Absolutely. And posture changes, right? Your center of gravity is going to change.
Right.
That's going to create some pain and discomfort. And then, with digestion, we get constipation, we get things like that. So the cranial is really good for the moms in that term, or in that respect, just because you're really facilitating what do they need, rest and digest. And so that's what we're trying to really get you to. And with new moms too, we see a lot of babies and moms together because we really see them as one still. I mean, they're outside the womb, but really they're so connected. So,
True.
they're still one. And so we treat a lot of them, I hate to say treat, we see and care for a lot of them together. Because of that reason, we see them
Pieces
as
of a
one.
puzzle.
Absolutely. And so I think a lot of the problems that people have with the traditional type of birth is the separation and, seeing them as two different patients, and we like to see them as one. So.
Right. Well, and even just the changes inside a mom. Once baby's born, the uterus starts to shrink down.
Absolutely.
There's organs that need to go back where they belong and things like that. So to recap, if you're pregnant, you need to see a chiropractor. If you're in labor, chiropractor could help. If you have a baby, see a chiropractor. Your baby should see a chiropractor. Are you getting like a theme here?
There's a common theme.
There is a common theme.
Yeah.
The more adjusted and healthy your body is, just the better it is for you in general. So what are you going to be doing at Babies in Bloom?
So excited. Like I said, what a beautiful space. And I've always been, every time I have a baby, I feel like, why am I not a midwife? Because I love what I do, but man, being around birth is so special, and you know that. And after having two, I mean, every time you just feel so connected to the providers, and we use a midwife that works here as well, so we just love it here. We attended a meeting, and this lactation support kept coming up, and it's something that's so common, and so that's what started the conversation. But we, like I said, we're in Del Mar, so we're North County, but we're pretty southern, and so a lot of our moms, especially the military moms living up here, have a hard time getting down, especially if their husband's overseas and their family's in a different, state. And so we spoke to Rochelle about maybe coming here once a week to start, and seeing the moms here and providing just the service that we do for the convenience of having it here, and also just to be surrounded by birth. And I'm hoping I hear some labor screams in the background and things like that. So we're just really excited for the opportunity.
And as a lactation consultant, I'm really excited to have somebody with their breadth of knowledge for a quick, easy referral, because I always tell people part of latch is kind of just how the baby's whole body is coming together after birth, and really taking time to understand how, if your jaw is to the side, if your head is tight, if all of those things are happening, it's going to be really, really hard for you if you're having breastfeeding difficulty anyhow. So,
and it's so common, unfortunately. I mean, so common to see breastfeeding issues, and here you think, even if you've had this birthing center, that everything's going to go perfect, and unfortunately a lot of times it doesn't, and it's really hard for a lot of moms. And so it's something that we find so vital, breastfeeding, that we'll do anything we can to help, and that. Yeah.
And partially I'm just kind of happy for my clients, because I refer so many people down there, and so now I'm like, no, you don't even have to drive, you can just stay right here, they're going to come to us. So I think it's really exciting.
And they love being here. We have someone outside who we told we were going to be here, and they're like, I'm coming, because
she has a groupie. She literally has a groupie outside the door.
Yeah, I think she's looking at
Well, before you leave,
Yes.
just a little quick getting to know you. So now we
Sure.
know how Dr. Kim is with like medical stuff and all, but now we want to know Dr. Kim the person. So I have a cheat sheet. Can't look, so you can't give me your answer. Rapid fire, just the first thing that comes to your head.
Okay.
Beach or mountains?
Mountains.
Cake or pie?
Cake.
Dogs or cats?
Dogs.
Coffee or tea?
Coffee. Absolutely.
Morning or night?
Night.
Oh, night owl.
Yeah, you hear about moms taking that like 12 to 3 a.m. window for themselves.
Yes,
That's me.
That's me.
Yeah.
Okay, no. I am the 5 a.m. person. We will never hook up in the middle of the night.
Yeah.
Breakfast or dinner?
Dinner.
Bath or shower?
Shower.
The Office or Parks and Rec?
Ooh, Parks and Rec. I have yet to watch The Office. Don't get mad.
these are things.
I'm a friends, like, hardcore groupie friends.
Well, friends.
Yeah.
See, friends totally.
Okay.
Friends 100%.
We can meet there.
Friends more than Parks and Rec or The Office, frankly. And last but not least, pancakes or waffles.
Ooh, that's tough. I have to go with waffles. There's so many. I mean, with either,
you can do a sweet, you can do a savory.
Absolutely.
Basically, what I have just learned in the last 2 minutes, Dr. Kim is the yin to my yang. We are not at all similar, but together we're a good team.
And we have a similar goal. I wanted to mention, because I forgot, we do offer military discounts, just being in San Diego and North County in general. Just want to point that out. Yeah.
Well, thank you for coming in.
Yeah.
Sorry for our technical difficulty earlier. We'll figure this out and we'll get it up for you.
It's not our specialty.
It's not our thing. Our thing is people, not
That's
technology.
right.
It's not what it has to be.
Babies.
And baby and big mommies too.
And moms. Yes.
All the things.
Families, everyone.
All right. Well, thank you guys so much for
All right,
joining
guys.
us, and have a good day. Thanks
Thank
for coming
you.
in.
Thanks, Rochelle.